Welcome to the Deep Dive. Today, we're plunging into a topic that really touches everyone, the future of healthcare. We're taking a look at an insightful paper from the Journal of Industrial Information Integration. It's called Industry 4.0 and Health, Internet of Things, Big Data, and Cloud Computing for Healthcare 4.0. Our mission today, to pull out the key ideas on how technology is fundamentally changing, well, how we stay healthy. Okay, let's unpack this. We hear terms like eHealth, maybe smart health, but this paper talks about healthcare 4.0. That sounds bigger. What's the core difference here?
Yeah, it's a really important distinction. While eHealth is more generally about applying ICT to healthcare, Healthcare 4.0 is something else. It's specifically built on three main pillars: the Internet of Things, big data, and cloud computing. Think of less as an upgrade and more like a revolution, sort of like how Industry 4.0 changed manufacturing completely. Proactive, interconnected systems.
Got it. So these three are the bedrock. Let's start with the Internet of Things, IoT. What does that actually look like in a healthcare setting, especially this idea of constant monitoring?
Right. So IoT means you have this pervasive network of objects, sensors, phones, actuators, all talking to each other. In healthcare, this gets really personal. We're talking wireless body area networks, W-bands. Imagine tiny devices you wear, or maybe even devices implanted in your body, constantly sending out your vital signs.
Implanted. Wow.
Exactly. There are terms like IoMT, Internet of Medical Things for connected implants, maybe a smart pacemaker, or WikiIoT, wearable IoT, using body sensors for automated actions. It's like having a personal digital health guardian. All this allows for constant, real-time monitoring. It pushes healthcare out from just the clinic, makes it more continuous, and ideally could lower costs, too.
That's amazing real-time data from inside you. But okay, with all this incredibly sensitive personal data, what happens next? Where does it all go? And maybe more importantly, how do you make sense of it all to actually improve health? This must be where cloud and big data are essential, right?
Absolutely. You've hit the nail on the head. Cloud computing gives us almost limitless resources on demand for computing power, storage, communication. It's powerful, it's cost-effective, and it enables this idea of healthcare as a service.
Healthcare as a service, like,
Like remote consultations becoming standard, maybe monitoring chronic conditions seamlessly from home with a connected device, or AI analyzing your scans remotely, delivered like a utility. And there's also fog computing. That processes some data closer to you, closer to the devices.
so faster reaction times.
Exactly. Think of it like a mini cloud in the hospital or even your home. It reduces that delay, that latency, crucial for things like emergency alerts or maybe automated insulin delivery. You can't wait for data to go to a distant server and back for those.
Okay, so cloud handles the scale and delivery, but making sense of it all, that's big data.
Precisely. Big data is how we extract the value from this just massive amount of information. It's defined by those V's, the sheer volume, the velocity of data streaming in real time, the variety sensor data, EHRs, genomics, all sorts. The veracity, which is about how trustworthy that data is, and ultimately the value. This whole combination lets us move beyond just describing what happened in medicine. We can become predictive, maybe even prescriptive, almost like a health forecast just for you.
This really does sound like a different world, not just theory. So bringing it down to earth, what does this mean for you, the listener? What real-world applications are we seeing or maybe expecting soon from Healthcare 4.0?
That's the key question, isn't it? How does it change daily life? Well, one big area is personalized healthcare, sometimes called P4 medicine: predictive, preventive, personalized, and participatory. So moving away from treating everyone the same.
Tailored treatment based on my biology.
Exactly. Imagine knowing exactly which medication works best for your specific genetic makeup, rather than trial and error. A truly bespoke treatment plan. Another huge area is assisted living, enabling people to age comfortably at home for longer. Remote monitoring, sure, but also AI systems learning your routine, detecting anomalies, maybe a fall, and alerting caregivers or emergency services.
That could provide real peace of mind.
Definitely.
Yeah.
And even seemingly simple things like medication intake monitoring, tackling non-compliance, maybe even through smart pills that confirm they've been taken.
Okay, the potential seems enormous. Proactive, personalized, it sounds incredible. But a shift this big, there have to be challenges, right? Significant hurdles. What should we be aware of?
Oh, absolutely. While the benefits are clear, better devices, new ways to deliver care, the challenges are significant. Data privacy is, well, it's huge. We're talking incredibly sensitive health data,
Hmm.
often processed on systems owned by third parties. That needs robust protection.
And security, I imagine.
Security is critical. The risk of hacking connected healthcare devices, the consequences could be dire for patient safety. Think about that smart pacemaker or insulin pump. Scalability is another massive issue. We could be talking trillions of connected devices eventually. Managing that network, that data flow, it's an immense technical challenge. And we absolutely have to talk about the digital divide.
Meaning access.
Yes, we need to ensure these amazing advancements benefit everyone, not just people in cities or people with high incomes who can afford the devices and the connectivity. Equity is crucial.
So this transformation to Healthcare 4.0 promises care that's everywhere all the time and perfectly suited to the individual. Continuous personalized medical services. It leaves us with a big question, doesn't it? As we weave these powerful technologies deeper into our lives. How do we strike that balance? How do we harness this incredible potential to improve health while safeguarding privacy, ensuring rock-solid security, and making absolutely sure that everyone, everywhere can actually access these potentially life-changing innovations? Something to think about.